Dr. Anand Swaminathan joins us now. Hi, doctor. Good to see you. He's an assistant professor of emergency medicine at St. Joseph's Hospital, and we love when he joins us. So first, if you could just tell us, what do you make of the calls for booster shots? Should the focus right now be on these boosters, on these third doses in many cases, when there's still millions of people in the country who haven't even had their first?
I don't think the science is there for boosters yet. And I think for universal boosters, we're nowhere near that mark yet. When we look at the efficacy of Pfizer and Moderna at 6 months, we're talking about 97% for Pfizer, 93% for Moderna against severe disease and hospitalizations. That's still pretty robust protection, and we should be happy about that. I think universal boosters is not the way to be going right now, because we should be focused, A, in the United States on vaccinating everybody who's not vaccinated yet, and then also globally on getting this vaccine out, because that's how we can really stop variants from being created and then spreading to other places. As far as boosters, I think there are probably some groups where boosters can be helpful. Those with severe immunocompromise, like patients with solid organ transplants, nursing home patients, the very elderly and frail. These are groups that probably will need a booster very soon. And I think that's where we should be focused. But universal boosters are not necessary at this time.
So let's listen to what Moderna CEO said about boosters coming this winter when it comes to the Delta variant.
Delta is a very different virus than the virus we had initially designed in all of our vaccines. And so it's important to think about boosting. If you give a third dose of the same vaccine that is currently used in the US, you actually see a very important increase in geometric mean titer, the quantity of antibody.
So, doctor, my question here is on these variants. So we know there are other variants out there. There were others before Delta. There will be others after Delta. So is there a chance we could need a booster every time a new variant comes along?
Again, the science really isn't there yet for us to know about that yet. We're not sure is really the answer. We may need a booster. This may be like a yearly flu shot. This also could be similar to what we see with hepatitis B or MMR, where you get a series of 3 vaccines and then you're done, and that's all you need. And the science might end up somewhere in between. We just don't know yet. We have to keep looking at this. And remember that antibodies isn't all of the immune system. There are other pieces that go into play in creating immunity. And so waning antibodies doesn't mean that we are now susceptible.
Now, doctor, let's talk about children. Of course, many are getting ready to go to school, if not already returning to school. If they're under 12, then they haven't been eligible for the vaccine. So how different is the Delta variant when it comes to kids? We know that we've learned so much in the last few months and weeks about this variant hospitalizing more people, and a lot of them are younger than we saw when COVID was bad last year. So what should parents know about kids, the Delta variant, them being unvaccinated, and them heading back into a classroom?
We are clearly seeing spikes amongst kids, both the kids that can't get vaccinated, as well as that 12 to 17 group that can get vaccinated, but they're not getting vaccinated. So we're clearly seeing those spikes. If we look in New Orleans, they're telling us that 50% of the kids that are being hospitalized were previously healthy. 50% of kids being hospitalized need oxygen or an ICU bed. And of course, that underlies the fact that there are no ICU beds, pediatric or adult ICU beds in many of these states where they're seeing surges. So it's really a shame. What we need to be focused on is in that 12 to 17 group, getting them all vaccinated. That's the best thing to do to protect them. It also protects everybody around them. And that's an important piece of getting vaccinated. It's not just to protect you, it's to protect those around you as well. And then for those kids younger than 12, we really need to be looking at layered mitigation. That means universal masking in schools in order to keep those schools safe and open, vaccinating everybody around them, and then also distancing and not doing those indoor things with large groups.
All right, Dr. Anand Swaminathan, lots of good advice there as kids head back to school. Thank you so much. Good to see you.